Hello and welcome to the State of Montana Benefit Plan, State Plan New Employee Benefits presentation. This presentation is a supplement to the New Employee Benefits book that you will receive in the mail from the Healthcare and Benefits Division, HCBD, upon starting your job. You can also access an online version of the Employee Benefits book at any time by clicking on the Healthcare and Benefits Division logo or visiting the website at www.benefits.mt.gov. We highly recommend that you carefully read the New Employee Benefits book to gain an understanding of the benefits and choices available from the state plan. If you have any specific questions that are not covered during the presentation, please call or email the Healthcare and Benefits Division, HCBD, at 800-287-8266, and the TTY number is 406-441-1421, or benefitsquestions@mt.gov. You may also at any time click on the benefits website link at www.benefits.mt.gov. The state plan is self-funded, and the funds that pay for plan member expenses and benefits come from two places. The first is the employer contribution. This is a per-month contribution paid by the state of Montana on behalf of each employee. This amount is set by the legislature and funded by income from state taxes. The other place the money comes from for income is you, the plan member. Your monthly benefit contribution is calculated based on who is enrolled on your plan and which optional benefits you have elected. When you go to the doctor or dentist, or fill a prescription for medication, or use the vision plan, a bill is sent to one of our third-party administrators, or TPAs. The state plan contracts with these TPAs and processes and pays based on the benefit design and coverages of the state plan. A small amount also comes out of the state plan to pay administrative costs, like HCBD staff salaries and the contract fees for the TPAs. Administrative expenses represent a very small amount of our yearly spend. Any remaining funds are used to fund our plan reserves. Plan reserves are used to offset and save for unexpected costs that the state plan may be responsible for, such as federal and state regulatory mandates and larger than expected claim costs. In order to take full advantage of your state plan benefits, you will need to enroll in benefits within the first 31 days of your date of hire. If you enroll in benefits within those first 31 days of your date of hire, your coverage will be effective as of your hire date. You may go to www.benefits.mt.gov to begin your enrollment. If you do not enroll in benefits during your initial enrollment period, you will automatically waive your coverage. As an employee, you can enroll in the core benefits after the first 31 days, and your effective date will be the first of the month following the date you choose to enroll. But you will miss out on enrolling in the optional benefits offered, such as dependent coverage for medical, dental, vision, hardware, life insurance, dependent life insurance, long-term disability, and flexible spending. If you don't enroll within 31 days of your date of hire, you will only be able to add those dependents to your state plan benefits if you qualify for a special enrollment period or during the annual open enrollment period, which occurs annually for 2 weeks in the fall. To get started with your new employee enrollment, you will visit www.benefits.mt.gov and click on Get Started on the Enroll MT button. You will log in by entering your username and password. If you are accessing the site on the State of Montana network, you will automatically enter the system and you will not be required to register. If you are a first-time user and you're accessing the system outside the State of Montana network, you will go through a registration process of setting up a username, password, and security. Our company key is State of Montana, which is case sensitive. There is a mobile app that you may download called My Choice Mobile. In order to sync the My Choice mobile app with the enrollment system, you will need an access code which is available on the home page of the enrollment system. Once you have completed your registration and accepted the terms of the system, you will be led to the home page that contains the Start Here button. Clicking on the Start Here button will begin your enrollment, and you will follow the prompts to enroll in your benefits or to waive coverage. You must make your elections by the deadline shown on the calendar, or the coverage will be waived. Remember, if you do not complete your benefits enrollment during your initial enrollment period, which is within 31 days of your date of hire, you will automatically waive coverage. As an employee, you can enroll in core benefits after those first 31 days, and your effective date will be the first of the month following the date you choose to enroll. But you will miss out on enrolling in the optional benefits offered, such as dependent coverage for medical, dental, vision hardware, life insurance, dependent life insurance, long-term disability, and flexible spending. Once you click the Start button to begin the enrollment process, you will first be prompted to review your personal information that we have on file. Most personal information for State of Montana employees is retained in SABRS. Therefore, if any of your personal information shown on the personal information page is inaccurate, with the exception of your marital status, you will be directed to SABRS to update it. If you need assistance updating in SABRS, please contact your HR and payroll staff. After you verify your personal information and you enter your marital status, you will begin the actual enrollment process by clicking Next. The next page is the Dependent Information page. If you intend to enroll a dependent on the state plan benefits, including spouse supplemental life, they must be listed as a dependent in this section. Be aware that if you enroll a spouse or domestic partner and/or dependent child or children, you will be required to provide documentation upon enrollment which verifies their eligibility as your qualified dependent. After completing this section, click Next to proceed. On the preceding tabs, you will have been prompted to make your benefit elections, and as you make your elections, each page opens with a blue box that contains very important instructional information. Please read the blue boxes at the top of each page to be certain that you are accurately completing your elections. You will be asked to make elections for each state plan benefit available to you, for example, medical, dental, vision, life, etc. You will begin with the medical plan. If you wish to elect this benefit, click the Select button by the benefit, and then go on to indicate the coverage tier that you would like to choose for each benefit. For the medical plan, you will indicate which dependents you would like enrolled in the plan. This is the coverage tier. As you go, you will be able to track your elections and the associated costs along the left-hand side of the screen. Again, make sure you pay close attention to the information contained in the blue box at the top of each enrollment tab for the important information we have given you about each benefit. The vision benefit is divided into two sections. The basic vision is available at no additional cost and provides you coverage for an annual vision exam for a $10 copay. The vision hardware plan provides some coverage for vision hardware such as contact lenses and glasses, but it has an additional out-of-pocket cost to you. Whoever is covered on your medical plan election will be covered by whichever vision plan you select. You must elect either basic, vision, or vision hardware. And if you choose the vision hardware plan, you receive both vision benefits. When you have completed all of your benefit elections, you will be prompted to review your elections and the associated cost for each election. And keep in mind, the associated cost each selection is the bi-weekly payment amount that will be taken from each of your paychecks. In order to complete your enrollment, you will have to click the Approve button. If you do not approve your benefit elections, they will not finalize, and you will not be enrolled in state plan benefits. Once you click Approve, you will be given the opportunity to print a benefit summary of your elections. The benefit summary is also available to you at any time by logging into the enrollment system. The benefits enrollment system is available to you at any time. This system can be used to update beneficiaries, make mid-year changes, review your enrollments, etc. throughout the entire year. Please visit the HCBD website frequently to see updates and current plan information regarding your state benefits. Now let's talk about the state plan benefits available to you. This information will be helpful as you complete your elections using the enrollment process that we just discussed. When a new employee enrolls in benefits, they must enroll in the core benefit. Core benefits include medical, which does include a prescription drug coverage plan and coverage for one annual eye exam, dental, and basic life insurance for the employee only. The state plan does not provide coverage for any work-related illness or injury. This includes the Montana Health Center. If you or anyone covered on the state plan, including your dependents, gets hurt or sick while working, the state plan will not provide coverage, even if you or a covered dependent has signed a work comp waiver. You will want to make sure that you have the proper insurance coverage in place to cover work-related injuries. As a state of Montana employee, you are covered by workers' compensation insurance. As a new employee, you have optional benefit choices available to you for an additional out-of-pocket cost. You have the option to add a spouse or domestic partner and/or dependent child or children under the age of 26 to medical, dental, and vision hardware benefits. If you enroll a spouse or domestic partner and/or dependent child or children, you will be required to provide documentation upon your enrollment which verifies their eligibility as your qualified dependent. You are also able to enroll in optional benefits like medical and dependent care flexible spending accounts, extra life insurance for yourself and your dependents, and long-term disability insurance. Please see your new employee benefits book or visit the HCBD website for more information regarding optional benefits. This slide shows the monthly cost of the state plan coverage for medical, dental, and the vision hardware benefits for yourself and any dependents you wish to enroll. The employer contribution amount is $1,054 per employee per month. As a new employee, you will have the opportunity to participate in the Live Life Well incentive program and earn an incentive towards your monthly benefit contributions for the next plan year. Please watch for important information regarding how to earn the Live Life Well incentive. See your new employee benefits book or visit the HCBD website for more information. As a state plan member, you and your covered spouse or domestic partner and/or child or children receive medical benefits as defined by the state plan. Listed on this slide is a summary of the copays, deductibles, benefit percentage amounts, and the maximum out-of-pocket associated with the medical plan when you receive services from a participating provider or facility. All deductibles and maximums are based on a plan year, which is January 1st through December 31st. Please review your new employee benefits book for complete details on medical plan cost sharing. If you use a non-participating provider or facility in Montana, You pay the cost sharing shown previously, and the state plan will pay a fair rate for your care. But the non-participating provider may balance bill you for more. You are responsible for this balance bill, and it does not count toward your deductible or maximum out-of-pocket. You should call your Allegiance Health Plan to determine the status of the providers and facilities in Montana. If you use an out-of-state participating provider or facility, non-participating provider or facility, the cost sharing is shown in this table, and remember, these amounts are separate from the deductible benefit percentages and maximum out-of-pockets for participating and non-participating providers and facilities in Montana. As a part of the medical plan, in addition to the medical benefits, you receive one annual eye exam with a $10 copay at a participating provider. You receive prescription drug coverage and the use of all the Montana Health Centers at no cost. Allegiance Benefit Plan Management processes the medical claims for our state plan. Cigna processes the vision claims for the state plan, and Navitas Health Solutions processes prescription drug claims. Remember, it is the state plan that decides the rates, out-of-pocket costs and coverages, and you will receive an identification card in the mail from Allegiance, Cigna Vision, and Navitas Health Solutions within 2 weeks of your enrollment in benefits. Employees and covered dependents over 2 years of age who are covered by the state plan can use any of the Montana Health Centers. The state plan has health centers in Anaconda, Billings, Butte, Helena, and Missoula. The Montana Health Centers are much more than urgent care. You can make a Montana Health Center doctor your primary care provider. The Montana Health Centers provide the same kind of services that a regular doctor's office provides. If you already have a primary care doctor, you can still use the Montana Health Center for no-cost physicals, health screenings, lab work, vaccines, and more. So call and ask the Montana Health Center if you have any questions about what kind of services are available. You may click on the logo to access the website for the Montana Health Centers. The Montana Health Centers are operated by a company called Care Here. The state plan pays 100% of the costs associated with the care plan members receive at the Montana Health Centers. So that means that any service that you receive at a Montana Health Center is paid in full by the state plan, and you'll never get a bill. However, please be aware that services received outside the Montana Health Center apply to regular state plan benefits, even if a Montana Health Center provider makes a referral. To make an appointment, visit www.carehere.com. If you're a first-time user, the system will ask you for your code, and your code is MANA9, M-A-N-A, and the number 9. Call 855-200-6822 with any questions. Or you can also use the Care Here app, which you can find by searching Care Here in your phone app store. Navitas Health Solutions is the state plan's pharmacy benefit manager for the prescription drug portion of our drug plan. With Navitas, you will have a retail pharmacy network benefit of 34 days for filling prescription medications, as well as a retail network or a mail order 90-day option. Lumicera is the preferred specialty pharmacy for specialty medications, and you will want to visit www.navitas.com to get information regarding the state plan's participating network of pharmacies, as well as be able to review the formulary, which is the listing of covered medications and the tier in which they are covered. Here's a look at the prescription drug plan copay structure. Notice that if you are on a maintenance medication or a medication that you take every single day, You would save money by using the 90-day fill option, as you receive 3 months of medication for just 2 copayments. $0 preventive products. Certain preventive medications are $0 at either retail, the 34-day supply, or the retail mail order 90-day supply. Tier 1 medications are preferred generics, and some low-cost brand products are $15 for the 34-day supply and $30 for the 90-day. Tier 2 is the preferred brand products and some high-cost non-preferred generics, which are $50 for the 34-day supply and $100 for the 90-day supply. Tier 3 are non-preferred products and some high-cost non-preferred generics that are paid at a 50% coinsurance for either a 34 or a 90-day supply. This coinsurance does not apply towards your maximum prescription out-of-pocket amount of $1,800 per individual and $3,600 per family. Tier 4 are the specialty medications provided by Lumicera, which, as I mentioned, is the preferred specialty pharmacy. These are a $200 copay. And if you get your specialty medications from a retail network, non-preferred specialty, or an out-of-network pharmacy, there will be a 50% coinsurance, which again does not apply to the maximum out-of-pocket amount. You have the choice to fill your maintenance medications and get a 90-day supply at a local in-network pharmacy or at any one of the state plan's 3 participating mail order vendors: Costco, and you don't have to be a Costco member, MyRx, or Ridgeway. When you're filling a 90-day supply of medication, again, you can get a 3-month supply of the medication for 2 copays versus 3. Please consult your new employee benefits book for details or visit the HCBD website for more information on the prescription drug plan. The prescription drug plan has a separate maximum out-of-pocket from the medical plan. The maximum out-of-pocket for the prescription drug plan is $1,800 for an individual or $3,600 for a family. Tier 3 and Tier 4 coinsurance amounts don't apply toward the prescription drug maximum out-of-pocket. This maximum out-of-pocket will be based on a plan year January 1 through December 31. Delta Dental is the TPA that processes the state plan's dental claims. Remember, it is the state that decides the rates and the out-of-pocket costs and coverages. Delta Dental provides members with 3 network options: preferred provider, premier dentist, and non-network dentist. Choosing a preferred provider results in you, the member, paying the least. Contact Delta Dental by phone or online to ask questions about claims, billing, or request a cost estimate, or check the network status of your dental provider. You can also refer to the new member benefits book or HCBD website for more information on the dental plan. This slide shows the reimbursement amounts set by the state plan for dental services. The state plan pays an annual maximum of $1,800 per enrollee per calendar year. The dental plan applies a $50 deductible per enrollee or $150 per family per plan year to the basic and major benefits. Please note, the diagnostic and preventive benefits are not subject to the deductible and paid at 100%. Remember, every member covered on the medical plan receives 1 routine vision exam per year for a $10 copay. The vision hardware plan provides some reimbursement for frames, lenses, contacts, and specific add-on features for your glasses. The vision hardware plan is an optional benefit elected by you, the member. When electing the vision hardware plan, please be aware that any dependent, spouse, domestic partner, and child or children covered by the medical plan must also be enrolled in the vision hardware plan if you choose it. Also, please check to make sure that both your eye doctor and the store where you purchase your hardware are participating providers. You must re-enroll in this benefit every year during open enrollment. Review the details of the Vision hardware plan in your new employee benefits book or on the HCBD website. A flexible spending account, or FSA, allows an employee to set aside a portion of earnings to pay for qualified expenses, most commonly for medical expenses, but often for a dependent care or other expense on a pre-tax basis. Money deducted from an employee's pay and put into the FSA is not subject to payroll taxes, which can result in payroll tax savings. You are eligible to participate in a medical and dependent care flexible spending account. The flexible spending accounts are administered by ASI Flex. As an employee, you can set aside up to $2,650 annually for medical-related expenses. And you have the ability to roll a maximum of $500 of medical flex money over to the next plan year for use in that next plan year. This money is for qualified medical, dental, and vision expenses for you and your dependents, so check ASI Flex's website to see a full list of qualified medical expenses. Dependent care flexible spending has a maximum contribution of $5,000 per plan year, and this money may not be used for medical expenses. This fund is dependent care contributions that must be used to pay charges associated with child care, for children under the age of 12, or for qualified disabled dependent care while you work. For more information on the flexible spending account options, please refer to the new employee benefits book or the HCBD website. If you elect to participate in either one or both types of the flexible spending accounts, you will be charged $2.26 per month for the administration fee associated with flexible spending accounts. FSA reimbursement options include a debit card, which you will automatically receive if you elect medical FSA, online submission, smartphone or tablet, mail, or fax. For more information on the FSAs, please click on the HCBD website. This slide shows the monthly out-of-pocket costs for optional benefits of the additional life insurance for you, the employee, your spouse or domestic partner, and your child or children. Also listed are the monthly costs for accidental death and dismemberment, or AD&D coverage, and the monthly cost for long-term disability coverage. Every employee who enrolls in the state plan is required to enroll in the basic life insurance benefit as part of core coverage. The basic life plan is paid for by the employer contribution, and it gives you, the employee, $14,000 of life insurance coverage. As a new employee, you can choose to participate in Employee Supplemental Life. The Employee Supplemental Life 1 plan allows you to elect life insurance coverage up to your annual salary amount without evidence of insurability, or EOI, within the first 31 days of your date of hire. The Employee Supplemental Life 2 plan allows you to elect additional life insurance coverage over your salary amount up to $500,000 with evidence of insurability, or EOI. Spouse Supplemental Life Plan is available if you have elected Employee Supplemental Life and wish to purchase life insurance for your spouse or domestic partner. Coverage is available in $10,000 increments and is available up to the amount that you elect for Employee Supplemental Life. Any amount elected over $10,000 for Spouse Supplemental Life Plan is subject to evidence of insurability. As a new employee, you will also be eligible to elect Dependent Life. Dependent Life provides you with $2,000 of life insurance coverage for a spouse or domestic partner and $1,000 of coverage per dependent child. You may only enroll in Dependent Life during the first 31 days of your date of hire, or within 60 days after getting married, or within 91 days of the birth of your first child. If you do not enroll during the times outlined, you will not be eligible to enroll in Dependent Life coverage at a later date. Accidental death and dismemberment is available within the first 31 days of hire and is not subject to EOI. Enroll with or without dependents in $25,000 increments up to a maximum of 10 times your annual salary or $500,000. With the exception of basic life and dependent life, all the other life benefits may be increased or changed during the open enrollment or at any time with evidence of insurability. These benefits are provided by the standard life insurance company. Every employee has access to guaranteed long-term disability or LTD insurance in the first 31 days of hire. If you decide not to enroll in LTD coverage within the first 31 days of your date of hire, you must wait until open enrollment to sign up. And at that time, you will be required to complete an evidence of insurability and be approved for coverage. This coverage is $9.90 per month. In the event that you do become disabled, the insurance would replace 60% of your pre-disability wage starting 180 days after you become disabled. You also have the opportunity to earn $30 a month off of your 2020 benefit contribution by completing these 3 activities: a state-sponsored health screening, being nicotine-free, or if you're not nicotine-free, completing an alternative program, and completing and self-reporting an eligible next step activity. You may double your incentive if a covered spouse or domestic partner on your plan also participates and completes all 3 activities. Remember, all 3 activities must be completed to earn any incentive. Partial incentives are not available, and you must complete all 3 activities between November 1st of 2018 and October 31st of 2019 to be eligible for any incentive in 2020. On the next slides, we will go over each of these 3 activities in more detail and provide instructions for earning the incentive. To earn the incentive, we recommend that you schedule a state-sponsored health screening as soon as possible. You have 2 ways to access a state-sponsored health screening depending on where you live. You may either choose a day during the year that works for you and schedule an appointment for a health screening at any Montana Health Center in Anaconda, Billings, Butte, Helena, or Missoula. Or, if you can't make it to a health center location, we will send a team from the Montana Health Centers around the state each year. These are called off-site screenings. And the schedule for all the off-site events is posted and ready for appointments starting in mid-January. Appointments can be made at the health center any day that works for you. You can also find a full schedule of the off-site screenings and/or instructions for making a health screening appointment at http://healthcenter.mt.gov/health screenings. You may click on this link to visit the schedule and to make an appointment. Included with your state-sponsored health screening is a height, weight, blood pressure measurement, and you may also have a waist circumference taken, but that's optional and upon request only. Your blood will be taken, and a complete blood count, comprehensive metabolic panel, and lipid panel will be run for you. If you have other lab tests that you would like to add at the time of your health screening, you must bring doctor's orders or a prescription for these tests. Most tests can be added with a prescription at the Montana Health Center locations. However, if you attend an off-site event, you may only add a PSA, TSH, or HbA1c. Please bring your prescription, as the health center staff cannot complete any lab tests in addition to those listed without it. As a part of earning the incentive, members must self-report that they are nicotine-free, or if they're not nicotine-free, that they've completed an eligible alternative. There are 2 eligible alternatives: either completing a nicotine cessation program or a nicotine education session, and you must self-report your nicotine status or completion of an eligible alternative at www.myactivehealth.com/SOM for State of Montana. We'll go over the instructions on your self-reporting shortly. The first alternative is a completion of a nicotine cessation program, and you may complete any nicotine cessation program, but we have two available to state plan members at no additional out-of-pocket cost. The first is available to members able to visit a Montana Health Center. The second is available to anyone who lives in the state of Montana, and it's the Montana Tobacco Quit Line. The second alternative is completion of a nicotine education session, which is simply a visit to your provider for the purpose of discussing your nicotine use or exposure. This is appropriate for members who are not quite ready to quit using nicotine or who are exposed to nicotine only rarely or via secondhand smoke. You may find all the information about the alternatives here at www.benefits.mt.gov/nicotine-free incentive. Just to summarize, in order to be considered nicotine-free for this part of the incentive, you must not use any form of nicotine, which is cigarettes, chewing tobacco, pipes, cigars, vaporizers, or nicotine replacement therapy like Nicorette gum or lozenges. If you do use any form of nicotine product, you must then complete one of the two alternatives we just discussed. As a part of earning the incentive, members must also complete an eligible Next Step activity. This is a complete list of eligible Next Step activities, and it is also available at www.benefits.mt.gov/incentive. This slide is very small and is only intended to show how many different options our members have to choose from for this Next Step activity. Remember, you are only required to complete and self-report one eligible Next Step activity. There is a whole list of eligible activities in addition to the options we detailed here. You can choose to complete and self-report whichever one works best for you. You may find instructions for how to complete and check the status of all your incentive activities at www.benefits.mt.gov/incentive. To self-report your activities or to check on your incentive, please visit www.myactivehealth.com/SOM. You may also call MyActiveHealth at 855-206-1302 to get help with your account or using their website. The state plan offers the incentive program to all plan members and their enrolled spouse or domestic partner. If you think you may be unable to meet the standard of the incentive program, you may qualify for an alternative program or different means to earn the incentive. However, you must contact the Healthcare and Benefits Division, HCBD, as soon as possible at 800-287-8266 or the TTY number of 406-444-1421, or you may email us at benefitsquestions@mt.gov. We will then work with you and, if you wish, your doctor to design a program with the same incentive that is right for you. We will maintain the privacy of your personally identifiable health information and medical information that personally identifies you and that is provided through the incentive program will never be used to make decisions regarding your employment. Your health information shall only be disclosed to carry out specific activities related to the incentive program, such as responding to your request for a reasonable accommodation. You will not be asked or required to waive the confidentiality of your health information in order to participate or to receive an incentive. Anyone who receives your information for the purposes of providing you services through the incentive programs will abide by the same confidentiality requirements. We securely maintain that all electronically stored medical information we obtain through the incentive program and will take appropriate precautions to avoid a data breach. If a data breach does occur involving your information, you provided to us for the incentive program, we will notify you immediately. And a copy of our plan privacy notice is available at the HCBD website or by going to http://benefits.mt.gov/portals/59 documents HIPAA notice. The Employee Assistance Program, or EAP, assists employees and family members by providing counseling services, 24-hour crisis help, and many other life balance resources. Please call the number on the screen or visit the RBH website at www.myrbh.com. Your access code is the word Montana with a capital M. You may access these very important benefits at their website. Enrollment in the state plan is not required, and for any additional information, please refer to the New Employee Benefits book or visit the HCBD website. Here are some ways that you can make the most out of your state plan benefits. By doing these things, it will save you and the state plan money. Use participating providers and in-network pharmacies. You may visit the HCBD website for links to participating providers and in-network pharmacy directories. Please review your medications because some medications qualify for the 90-day fill at a retail or mail-order pharmacy. And when you fill 90 days at a time, you'll pay 2 copays versus 3 and receive 3 months of medication. Use the Montana Health Center whenever you can. The Montana Health Center provides you primary care at no cost to you. Take advantage of all the no-cost wellness and prevention programs available to you. Participation in these programs could reduce the amount of your monthly benefit contribution. And finally, please be aware that vendors may contact you with informative, cost-saving programs for you to participate in. They will never solicit your personal information. Your decision to participate is optional. Open enrollment is that time each fall when the state plan provides information about any changes in benefit contributions or benefits coming for the next plan year. It is also the only time to make changes to benefits like opting back into the Vision hardware plan or renewing your flexible spending accounts. Any changes you make are done online and they take effect the following January 1st. We encourage you to watch an education presentation to make sure that you're up to date about any changes coming in the benefits for the next plan year. If you have any questions about eligibility, who is covered on your plan, mid-year changes, payroll deductions, special enrollment periods, open enrollment, or the Live Life Well incentive program, you should contact the Healthcare and Benefits Division at 800-287-8266 or TTY 406-444-7462. You may email benefitsquestions@mt.gov or visit the website at www.benefits.mt.gov. If you should have questions about claims, bills, or explanation of benefits, EOBs, participating providers, individual account information, what's covered, pre-authorizations, how to make a Montana Health Center appointment, you should be contacting our third-party administrators like Allegiance, Navitas, Delta Dental, the Standard, or the Montana Health Center. Please refer to the back of your New Employee Benefits book for websites and contact phone numbers. Thank you for viewing the New Employee Benefits presentation.